Hello, everyone. Welcome to this session. I am Sherry Weiser, co-founder and co-director of the UC Center for Climate, Health, and Equity. This session kicks off the second day of our launch event for our center. The vision of our center, to remind you, is to advance equitable and just climate solutions that promote human health and a healthy planet. Our mission is to harness that expertise and leadership of the health sector to drive ambitious climate action for health and health action for the climate. And we do this through 4 pillars of work, including education, research, health system sustainability, and policy. So for those of you who joined yesterday, we hope you enjoyed the conversations. And if this is your first event, just note that we will be sharing recordings of all sessions on our website in the coming weeks. Today, we have a wonderful series of 3 panel conversations on important and emerging questions within the field of climate change and health. First, we will talk about how to integrate climate change and health content into education. Next, we will look at how to address the rising mental health impacts of climate change. And the last session of the day is on how to advance climate policies that promote and protect health and equity. So please join us for these additional sessions, and registration information is in the chat now. Turning to our topic for this session, we have a very exciting panel today on building strong climate and health education throughout the education continuum from K through 12 to higher education. I will now introduce as the moderator, my close colleague and friend, Dr. Ariane Tehrani, who is co-founder and co-director of our Center for Climate, Health, and Equity, and who herself has tremendous expertise in the area of climate and health education. Arianne is professor of medicine and director for program evaluation and education continuous quality improvement for the School of Medicine. Her research has really informed local and global conversations and policies in educational equity and education for climate change and health. Her research underscores education as a core solution to the climate change and health crisis, and she examines practices that emphasize local and community engaged education to learning, clinical practice, and sustainable thinking. She designed and led multiple climate and health courses for a range of learners. She helped found the UCSF Academic Senate Committee on Sustainability, where she served as chair. And she currently serves on the Global Climate Leadership Council faculty engagement team and co-chairs the UC Sustainability and Diversity, Justice, and Equity Advisory Council. Finally, she was named as Faculty Climate Action Champion, an award given to one member at each UC campus in recognition for their great contributions to sustainability. So welcome, Ariane.
Thanks, Sherry. And it's great to see everyone here today. So why are we here to talk about education as a part of the climate change, health, and equity dialogue? And, you know, there are obvious reasons, right? People need to know the kinds of health impacts they are facing from the climate crisis. And, you know, raising community awareness among vulnerable populations, including youth, about the climate gap and inherent climate inequities is critical. Of course, health professionals also need to be trained to respond to the climate health impacts they are seeing in their patients. And finally, we all need to reflect on our role and responsibility in combating the health effects of the climate crisis. But there are additional reasons to talk about education. You know, education is a core solution to the climate crisis, right? If we look at the history of education and the evidence around education, it has pointed to the fact that education plays a vital role in instigating societal change. For example, we know from years and years of research that higher education is linked to increased tolerance, prosperity, civic engagement, just to name a few outcomes. And research has also shown that education institutions play a critical role in leading that transformative change and progress in society. A little over a decade ago, Gloria Ladson-Billings spoke about what she called culturally responsive education, which is an approach to education that promotes academic achievement, but also socio-political awareness by helping students realize and honor their own cultural beliefs and practices while acquiring access to the wider culture. And you're probably asking, you know, what does cultural responsive education have to do with climate change and health education? A climate responsive education is very similar in its underlying assumption. There are a lot of parallels, right? So a climate responsive education promotes and prioritizes learning about the environment throughout the continuum of education, teaching students to critically question the environmentally harmful practices that we often take for granted, that we don't even sometimes think about. Teaching climate advocacy in action as a form of change, and teaching to honor, promote, and live the beliefs and practices that show respect for the environment. Education is one of the core pillars of the center, like Sherry pointed out, and the UC system trains nearly 300,000 students to learn on our campuses each year. We are able to harness this interdisciplinary power of the University of California with its leading diverse researchers, clinicians, educators, and learners to address the foremost health challenge. When we think about how many learners we could reach and the role of our campuses in educating and training California's youth and workforce, we have the opportunity to shape the way in which the next generation learns and thinks about climate change as a health and health equity issue. And so with that in mind, now I'm going to turn to our distinguished panelists who will speak to their work and perspective toward this important imperative of education. So Gaurab Basu is a physician and founding co-director he's the co-director of the Center for Health, Equity, Education, and Advocacy. He's an instructor at Harvard Medical School and faculty affiliate in the Department of Global Health and Social Medicine, as well as a health equity fellow at the Center for Climate Health and the Global Environment, and faculty affiliate at the FXB Center for Health and Human Rights at the Harvard T.H. Chan School of Public Health. Dr. Basu has received numerous awards in medical education, including the inaugural Equity, Social Justice, and Advocacy Faculty Award and the Charles McCabe Faculty Prize in Excellence at Harvard Medical School. Dr. Basu has been recognized nationally for his work, named to the 2021 GRIST's 50 list of climate leaders, and recipient of the 2020 Union of Concerned Scientists Science Defender Award. Dr. Nicole Redwars is a member of the Dianne First Nation in Dianne, Northwestern Territories, Canada, and has worked with Indigenous patients and scholars in communities around the globe her entire career. She is an assistant professor in the Department of Family and Community Medicine and the Department of Indigenous Health at the University of North Dakota, where she helped develop and launch the first Indigenous Health PhD program. Dr. Redvers is co-founder and current board chair of the Canadian charity, the Arctic Indigenous Wellness Foundation, based at Yellowknife, Northwest Territories, providing traditional Indigenous-rooted land-based wellness supports to Northerners. She has been actively involved at regional, national, and international levels, promoting the inclusion of Indigenous perspectives in both human and planetary health research and practice. She is the author of the trade book titled The Science of the Sacred, Bringing Global Indigenous Medicine Systems and Modern Scientific Principles. Cecilia Sorenson is the director of the Global Consortium on Climate and Health Education at Columbia University, associate professor of emergency medicine at Columbia Irving Medical Center, and associate professor of environmental health sciences at the Mailman School of Public Health, Columbia University. Following her medical training, she completed a 2-year fellowship in climate change and health with the National Institute of Environmental Health Sciences. Her work focuses on the intersection of climate change and health and how policy solutions, clinical action, and education can build resilience in vulnerable communities. She currently serves on the working group for the National Academy of Medicine's Climate and Human Health Initiative. She was an author for the U.S. 4th National Climate Assessment and serves as a technical advisor for the Lancet Climate and Health U.S. Policy Brief. She is the co-editor of the textbook Climate Change and Human Health, From Science to Practice. And Dianne Wilson-Graham is the executive director of the California Physical Education Health Project, a statewide network of physical educators, health educators, classroom teachers, and university scholars dedicated to the pursuit of excellence in teaching standards-based physical education and health education. The project is one of 9 discipline-based projects in the California Subject Matter Network that provides rigorous professional learning, creates communities of practice that promote high-quality teaching and teacher leadership, builds powerful partnerships between K-12 schools and universities, and honors teacher knowledge as the significant factor in student learning. Dianne has held a number of state and national leadership positions in health education and physical education, and has received many awards for the highest achievement in service, research, teaching, and administration in physical education and health education. The College of Science and Mathematics at Cal Poly San Luis Obispo named her its honored alumni. Thank you to all of you for being here. I would like to start off by asking you to tell us a bit about how you became involved in education around climate change and health. Please discuss the work you are doing in this area currently and why engaging in climate and health justice education is important. I'm going to ask Dianne to start first.
Good morning, and thank you, Ariane. Health education in California's K-12 schools focuses on students acquiring the knowledge and skills they need to adopt personal, family, and community health behaviors. And the environment and climate change are explicitly identified in our K-12 health education learning outcomes. Our work at the California Physical Education Health Project centers on advancing teacher content knowledge and their pedagogical practices to bring this very important learning to each of their students. One of the things that we have opportunity to do is to directly interact with K-12 students and their teachers. And we know that they are very aware of the climate crisis and what it means for them today and tomorrow. They're motivated to learn more about what they can do, and they're particularly interested in how to engage and empower others in this important conversation.
Thanks, Anne. That is incredibly insightful to know. Nicole, we'd love to hear your thoughts on the work you've been doing.
Thank you, and happy to be here. I think one of the most poignant cases of this question was about 3 weeks ago, where my home region territory had the first flood ever in its area, displacing thousands of people, mostly Indigenous peoples within that area. And one of the things that was completely apparent was the lack of preparedness, not only for education systems, but health professionals dealing with that issue. The hospital shut down. The closest center is 700 kilometers away. Nobody knew what to do with the patients, how to transfer, what was going to happen, because the runway was flooded, so planes couldn't get in for emerge evac. It was just such a poignant example of why preparedness, not only in terms of mitigation of climate change effects, but also adaptation and ensuring that our health professionals, which of course is the lens that I come from, are coming out from their educational institutes prepared and ready to adapt to plans, create plans, and think through some of the changes that we're going to continue to see going forward within the world.
Thanks, Nicole. Cece.
There we go. I was muted. So where I came at this was really from the perspective of an emergency medicine physician in training in a busy urban trauma center. And we always used to say that summer was trauma season. Well, why is summer trauma season? Because it's hot, because the air quality is terrible. And it's not just trauma season, it's our peak season for all different types of injuries, chronic disease exacerbations, violence, et cetera, et cetera, et cetera. And people used to sort of say in the ER, oh, it must be a full moon out, right? Like, something's going on out there in the world that's clearly affecting our patients or society, but, it's not the full moon, it's environmental health, it's climate change, and it's impacting our patients, and it's directly impacting our health systems. And, it's sort of one of the situations where, I think as an emergency medicine physician, we treat patients and we street them, we treat them and street them. But that sort of revolving door of, you're seeing patients, you're addressing their immediate concerns, and you're putting them right back into the environment that was causing their illness to begin with is just, I don't feel like a sustainable way to practice healthcare and to really act as a health professional in this world. And so, really getting upstream from that problem to me led me to this issue of how do we address climate change. And I think, you know, I've been, there aren't many folks in the health professions. There's a growing number who are really aware of this. And I think that, you know, education, as you mentioned, Dr. Tehrani, is just such a powerful way of there being advocacy, of there being our ability to harness our voices as health professionals together so that we're all giving consistent messages to patients, to policymakers, and that through that we can have change. It's also an imperative because, you know, we can't just keep, you know, carrying on business as usual because our hospital systems are getting inundated. And as Nicole just mentioned, they're going under with these climate events. So thank you.
That's, you know, both those themes are very significant, and we're going to be seeing so much more of that. And in preparation for that, it seems very critical to think about the framing that you've all provided so far. Gaurab, from your lens.
Yeah, thanks so much for having this panel, and I'm really honored to be on it with folks I respect so much. You know, I just really appreciate putting the value of education really at the spotlight here, because education makes us curious, it makes us compassionate, it makes us capable of seeing one another's humanity. I think that we're living in a time in which we've really got to ask ourselves deep questions about how we better take care of each other. And we're struggling with that, and all the disinformation and kind of miseducation out there is kind of driven by agendas that have not that at its heart. And we need to reclaim that space. We need to be educating ourselves so that we can be informed public citizens of this work. And so as a primary care doctor, you know, it's at the heart of my work to take care of my patients in my clinic and to recognize the ways my immigrant patient population is being impacted by environmental justice issues. But the truth is, it's not enough just to wait for them to come to us, as Cece was describing. We've got to get out there. We've got to get, you know, COVID, climate, gun violence is all teaching us that we have got to enter the public forum and discuss this space, because as an organizing principle, we've got to be creating a society, a healthcare system in which we are promoting health equity, how we can take care of one another. And so education for me begins with describing the ways that air pollution and heat, and infectious diseases, and mental health is impacted by climate change. It begins with understanding the science and rigorously knowing the data, but it only begins there. Then it's about building community. It's about creating these educational spaces where we can talk about our values, we can talk about the world we want to build, and we can do it together and really develop the skill sets of storytelling and of community building and power building so that we can proactively create that world we so desperately seek. And climate change is just foundational to all of that.
Mm-hmm. So sort of building on that a little bit, what do each of you think we absolutely have to be teaching our learners, and how should we be doing it? And I know you've all alluded to this a little bit, but really making it more concrete, you know, what are the things that we actually have to make sure they know, and how should they know that? What are the best ways for doing that? Nicole, love to hear from you, your thoughts.
Thanks. Yeah, absolutely. So 2021, the Planetary Health Alliance got together with a number of experts and scholars and practitioners within the area of planetary health education. And one of the key things that we absolutely pushed for as a part of that process was ensuring that the education framework absolutely centered around interconnection within nature as a key feature of education broadly, whether or not it was in elementary schools, whether or not it was in higher education. And the reason for that is very prominent within our Indigenous communities' ways of knowing, which is we've had this habit within Western cultures to disassociate ourselves from nature. In fact, we often refer to it as we are going out in nature. Nature is separate from us, comparatively to this embodiment of being nature, of one in and of itself nature. And that fundamental principle is interconnecting spaces, places, people, things, items, all aspects of world. It's a worldview that's inherent within Indigenous communities. And we've really went away from that. We can't keep doing mechanistic transactional responses to climate change because it completely misses the point of who we are as a people and our roles and responsibilities as stewards of this place and planet that we're here for a short time on. And because of that, interconnection within nature is the center point of the planetary health education framework because of that.
That makes perfect sense, tying back really to thinking about sort of that connection. I was reading this beautiful piece early this morning on exactly what you're just talking about and the actual sort of evidence around how that sense of feeling responsible for the environment, making sure that we are caring for it, has this, and we have the right tools with which to do that, right? So we know how to do that, are a core part of what we need to be doing, and how that in turn also brings a sense of internal peace to individuals working in that area. So love to hear your thoughts, Dianne, on this, sort of from the K-12 perspective. What do you think we should be teaching our young ones?
I really think we're very fortunate that the instructional infrastructure we have in K-12 education is really focused on both the knowledge and skills. And I think as everyone has referred to, knowledge and skills are both critically important for all age groups, but also to meet the goal. So in K-12 health education, there's a significant amount of cognitive or knowledge-based learning that our students are asked to do, and connecting strongly to the science of climate change, connecting strongly to other aspects of health. And then perhaps the most powerful part of that is the health enhancing skills that students in grades K through 12 are to learn. So I'll share just a few. Such as analyzing influences or being able to analyze an influence for a decision made, or even in this particular example, influences of what's influencing this climate change. And what is it that we as people have an opportunity to approach at its influential point? Accessing valid information, I think, is critically important for all learners at all ages. And then being able to make sound decisions and sharing and talking about those with others in an interpersonal communication model is particularly important. And all of those lead to the ability to practice climate enhancing behaviors. And so the K-12 world significantly embraces that idea of knowledge and skills with a heavy emphasis on skills, and sees that that's a significant, important approach in all areas of health, which can be applied to the climate crisis and the environment as well.
Yeah, that makes perfect sense. Cecilia.
Sure. It was interesting to hear what Nicole said about, this idea of being part of nature, because it's like we've been setting up these structures for the past hundreds of years that we're separate from it. And I feel like, yes, that is one of the things we need to be breaking down that barrier of, is really teaching. Specifically, we work with health professionals, that climate impacts health, right? We say it again and again and again, but it's sort of just trying to reinforce this idea that, we are not separate. And we go about doing it in a very scientific method, right? We say, here's all these papers which show that climate change impacts health, it impacts mental health, food security, all these things. We can point to all these things, but the bottom line is that we are connected to nature. And I think, we're trying to prove it in a Socratic method, right? But, that's really key to some of the work that we do, is really, trying to get health professionals to acknowledge and to realize the ways in which climate change is impacting not only their health, but health of their patients and their communities. And I think, the next step that we're really grappling with is trying to say, okay, now that we know that this is the case, what do we do? And I think that the most important thing that we try to reinforce is that health professionals have a key role here, and that there are concrete steps that we can take, right? We can act to protect the health of our patients and our communities, and more so, we need to act, right? We are the trusted messengers, the trusted communicators, and what we do matters and what we say matters. So I think that, really linking that acknowledgement of our role in climate change, how it impacts our health, and then saying, okay, now we need to do something about it. And I think that for health professionals, acting, in sort of an advocacy lens, as some might see it, is outside of the comfort zone for a lot of us. And so it's really almost redefining the role of health professionals to be more active and engaged citizens. And, I see that really as the future. So I'll just stop there. Thanks.
I love that point you ended on, because I do think that's the perfect transition to, I would love to hear from Gaurab, because I know that that's a huge part of the work that he does.
Yeah, I totally appreciate it. I'm resonating with everything that everyone's saying here. And, my kind of central mantra in this is that climate change is about our relationship to the earth, each other, and future generations. And so when I'm thinking about what work I want to do, in my mind, there's a lot of mending to do of all three of those relationships. And so I think my disposition is to really be thinking about how to build relationships to do advocacy work. And Marshall Gans, he's a Harvard Kennedy School professor. His work has been pretty influential in my work in teaching about community organizing. And so we started a fellowship called the Climate Health Organizing Fellows Program, which just launched applications earlier this week. I'm grateful to have many partners from this panel as well, including University of California. But what that framework starts with is that telling our stories is critical, telling our personal stories, our community stories, and the story of now. What is the actions needed? What's the urgency of this moment? In storytellings and values declarations, it allows you to build intentional relationships with people. When you can feel connected with one another, you create these deep relationships with folks where you say, hey, I'm gonna work on this with you. And even when I'm worried, even when I'm scared about these extreme weather events, I'm gonna kind of keep going on because I feel connected to this community. And that allows you to build a leadership structure. Those relationships allow you to understand what each person adds in terms of their value and skill sets. And from there, you can really develop strategy of like, how do you build power? I am really policy oriented. I think that, we have so many profound policies we have at place if we have at hand, if we could put them in place. But the problem is that we feel disempowered. We feel like we can't put these solutions in action. And I think by doing that work of the relational work, the storytelling work, the building of power, we can really change the paradigms in our local communities and be able to see ways we can implement these solutions. But each piece of this takes a ton of work. I would say health professionals need to do the work of building relationships with communities that rightfully are distrustful of the healthcare system in many ways. We've built a whole bunch of structures that have caused a lot of harm. For me, that is fundamental to being a good doctor. That's me saying we can't wait for all these impacts. Clearly, it's not going to work to allow all these harms of climate change to manifest and then try to take care of patients. That didn't work for COVID. That's not going to work for climate. And again, as everyone's speaking to here, we've got to enter the public forum. We've got to be leaders. We've got to kind of point a direction of how we can promote health and well-being and health equity and kind of proactively do that in the public space.
Actually, if we just stay with that for a second. So as you've sort of been talking about what is it that, we need to make sure we teach, how is the way in which you're thinking about education or the way in which you're proposing education different from what's currently in existence? What are the areas that you feel are needed to educate for this particular purview, and how can we as individuals or as groups or as entities help impact those areas of growth?
Yeah, I think, listen, my work at the medical school is really incorporating climate themes into every infectious disease course and respiratory course. We need to have the slides of showing how climate impacts health. That's the beginning of it. But I think too often we stop there. And what we really do need to do is, I think, this kind of identity formation work, this sense of like professional responsibility, how we cultivate a sense of like a call to action. And I think that's the different thing that we don't do enough of sitting with this and saying, we feel scared of this, we feel overwhelmed, this is hard, right? And by just stopping at simply the scientific mechanism level, we lose the opportunity to enter into the space, bring our full self as parents, as health professionals, as human beings into the space and say, what makes me come alive? What are those like deep values I want to speak to in my work? And the thing about climate being so big and touching every single part of health and healthcare is that everyone has a role here. Everyone has something to offer, and every person has unique value, and we need all of those skill sets. And we need to create educational spaces in which people are able to reflect on that work and then really see what their calling is. And I don't see enough of that happening.
Yeah, that idea of identity formation is so incredibly critical. And I would like, I think it's Nicole and Dianne, that's, in essence, what both of you have also been referring to, and sort of the answer to the prior question. Maybe Nicole, I can ask you to comment on sort of your sense of what should we be doing? How should that be different from what's in existence, that education that we provide?
Definitely. So 2 points with that, and I won't have time to go into Indigenous land pedagogical approaches, but I would encourage you to Google it if you're interested in that type of approach, which is a land-based pedagogy that is inherent within Indigenous teachings in communities. It's reflective based, it is land based, it's engaging directly within landscapes. And I was happy after I gave a guest presentation to a university in the UK a couple of weeks ago, that the professor had emailed me afterwards and said, you know, after our talk, we decided to go outside and have our discussion under a tree. And, you know, for me, that was a success because, you know, they had never done that before. And that was such a small thing, but it makes a difference when you're actually able to engage and create spaces. And land pedagogies are really looking at the land as an active teacher and an active healer, as a participant, as a part of the process, as opposed to some entity that you're just going to sit on. When it comes to some of the other considerations, I think one thing that I hark on a little bit in terms of process is that you know, there's the push even within the planetary health education framework on systems thinking and complexity. But in a lot of cases, even though we keep talking about that within climate and health spaces, nobody's actually doing it to the extent where we can think through concrete examples of relationships. And it's one thing that we've been doing quite often within our Indigenous health programming, is really urging students, because a lot of people don't realize that relational thinking, of course, in Indigenous communities is a form of systems thinking. However, the focus is primarily on the relationships between intersecting things, as opposed to a focus on variables, which is what we tend to focus on way too much within our educational learning processes. And it's challenging for students to do. And we have to really gently nudge and then push them a little bit to get out of that linear way of thinking and really start to sink their teeth into sort of this more circular and you know, dimensionless sort of approach to how variables interact. And that's the type of thinking that our elders have had for thousands of years and have been able to survive on vast landscapes around the globe because of the amazing observational skills and the way that they're able to intersect learning processes from the natural environment and apply them within lives.
That's a great point. I think in academia, we do tend to teach linear, isolated facts. And, you know, you learn throughout life, nothing is linear, nothing. Dianne, love to hear your thoughts.
Well, first, I'd like to acknowledge that I resonate with everything that everyone has said. And no matter the age of the learner, I think the suggestions have been highly relevant and very important. One of the things that we've had really good success with in K-12 schools is thinking about this work from an interdisciplinary approach. And I think that's a pathway forward. I've never heard an educator say that they don't need more time, that they don't need another course, that they don't need another opportunity to help learners learn more. So I think the interdisciplinary approach is something that tightly connected to success in this area. And I just like to share a very simple example, if I could, from the lower grades in elementary school. If we think about teachers having the responsibility to help learners read, write, speak, and listen, and do mathematical computations and learn about history and sociology, and I could go on down the list. Health education is also included in that. We've had great success with connecting English language arts or literacy skills with health education in the elementary grades. And again, a very, very simple example. If the learning is for young children to learn how to write a paragraph, why not combine that with the knowledge or skills from health education, where that paragraph can be written about the knowledge and skill developments needed, in this case, to connect to the environment and climate, in a personal and meaningful way. Because when the learner gets to decide those pieces of their own approach and what that looks like at the same time they're learning to write a paragraph, I think those are some really powerful opportunities we have with interdisciplinary approaches. And I think we know that those require authentic connections and accountability for all. and that environment, but they're very important. And someone just used this phrase that learning isn't linear. And learning isn't linear in any educational environment. So I think being able to think about these very high level practices in terms of making change related to climate are a significant pathway forward for all of us, no matter whether we're teaching first graders or whether we're working with students in medical schools. I think that approach is well deserving of our attention and our study as a possibility for moving ahead.
My daughter's third grade teacher would always say, learning is uncomfortable, and it should be uncomfortable. If it's not uncomfortable, you are not learning. You are not learning anything new, and you are not learning to question your own thinking. And I think that that is such an immensely important point. Cecilia, you are overseeing this huge entity that is trying to, push health professionals to think about how they should, what not just was in it, what isn't in existence, but really pushing sort of the mark on what folks need to know, how they need to know it. And how are you seeing sort of the work you're doing with the Global Consortium and leading it really addressing sort of those gaps in education? I think you're muted.
I should know by now, this far into the Zoom world. But no, thanks for that question. The Global Consortium it's a journey, so when I came here about 8 months ago, we had about 170 health institutions globally. Now we have up to 270 health professional schools in 50 different countries who at their highest level of the school have pledged to train their health professional students in climate and planetary health, which is so cool. And I think, in the beginning, there was a lot of push, there was a lot of outreach, and now people are coming to us saying, we want to be part of this. We want to do this. And I never thought, honestly, that I would see this transformation happen like in front of my eyes. It's always been such a push, I think, to get the word out there, but I feel like more and more people are kind of coming to this on their own. Now, I think, what the interesting part of this is that as much as, the cause of climate change is one thing, the solutions are myriad, right? Like there isn't just one solution that each location has to be able to deal with this. Health systems are at different levels of development. Health education systems are at different levels of development. And so, really, the intricacies of this are seeing, how can we support institutions wherever they are to start integrating, climate and planetary health into the work that they're doing. And, what we find there is that really relationship building, collaboration is how we're going to get there faster, right? I don't think we can wait for every group, every institution to develop their own version of the wheel. We need to be sharing versions. We need to be constantly communicating. And so much of the work that what we're doing is trying to connect people, right? If you are in Nigeria and you have a great idea, let's connect you with someone else who's interested in your region so that you can communicate and collaborate, because quite frankly, there aren't enough of us. And so we need to be bringing together the people that there are so that we can accelerate this transformation. I think that there's a lot more of us out there than we may realize, because the more and more we talk about this, the more people are kind of coming forward and saying, I totally get this. This makes sense, and I want to have a role in it. So what we're working on is, how can we engage people globally to do this? We're doing huge broad-based courses, partnering with Pan American Health Organization, with Ministries of Health, to try to get the word out there, and really trying to tailor our approach to whatever the region needs, right? Where are they at? What are they hoping for? And how can we help facilitate and accelerate that? And that's really just kind of the space we're in. And it is iterative, it grows every day, and we're constantly learning. So thank you.
Really, in terms of, if we could just stay with that, just like in terms of facilitation, right? How are you seeing sort of the ways in which global, local, or national policy mandates could help facilitate or potentially hinder this idea that you just presented? As you think about how we as educators, or you personally, through your work, can bring about changes in those conversations, how are you seeing that be able to happen at that sort of policy level?
Yeah, well, I'll give you an example. We just ran a huge course for Latin America, and we had many members of the Ministry of Health of Uruguay take our course and get the certificate. And that ended up contributing to them being able to check the box on their HNAP, their Health National Adaptation Plan, that they are training their health workforce, right? And so, what we see is that, as we rise up as health professionals, that it's actually been pretty welcome. And what we're trying to do now is think about how we can further connect health professional clinicians, researchers, et cetera, with the health policy communities at local, state, and national levels to have more dialogue, because I think it's incredibly welcome. And I'll give you an example. So this fall, we're working with the Inter-American Institute for Global Change Research to launch a workshop where we'll be bringing together teams of researchers from a region with policymakers, whether they be in ministries of health or environment, and have them working in co-creation of research to policy, rapid transformation, because we need more research, more knowledge to inform policy, so we have the health solutions that we need that are tailored to the geographic areas where the impacts are happening. And that's really the key there, because it's not really a one-size-fits-all model when it comes down to adaptation to the impacts of climate change. And so we're very strategically trying to figure out how we can accelerate those dialogues and really have that transformation. And we've been lucky to get some seed funding so we can actually fund these groups to do work in this space. And I'd just love to see more initiatives like that.
Yeah.
Ariane, can I add something to that? I'm just always so impressed when I hear Cecilia describe what she's doing, because what she's doing is ambassadorship, and working with these there's governments and decision-making bodies. And what I would say, in my work here in Massachusetts, going to the State House and local city council, things like that, the health voice is just often not in those spaces. And again, I just want to uplift the importance of health professionals being in those spaces, because that's what's impacting our patients. We're able to speak in very human terms, and frankly, we're able to bring a moral voice into those spaces, because I get super excited working with engineers and technology experts and the rest. But often that health voice is not representing the ways it's impacting human beings, and our ability to articulate these studies and describing the impact not only describes the problems, but I mean, we can really articulate how much profound impact. Can say 9 million lives a year, right? I mean, that's an extraordinary thing to say in these spaces. And I'm just struck at how often we are not represented in decision-making spaces.
Yeah, and it's funny, I went on the World Health Organization website and I was like, how many health professionals are there in the world? And the World Health Organization estimates there's 50 million health professionals, nurses, doctors, dentists, pharmacists. That is so many people. And if we have an ability to unite our voices, I think our ability to really humanize this landscape is so real, right? I think that's what we bring to this, as health professionals or as people speaking on behalf of health, is that real human feel to whatever the conversation is. If it's about building a new dam in a region, if it's about, an infrastructure project, we bring that human voice to the conversation. And so I think we're needed everywhere. And, that's really the struggle, I think, with education is how do you prepare health professionals who think they're going in to be a bedside nurse or a pharmacist or a doctor to be like, whoa, I'm not sure I signed up for this. I'm not sure I'm this person, and saying, no, yes, you are that person. These are your values, because I think they really are our values. But then how do we equip them to feel confident to go and fill those roles that we see are needed so desperately? Anyway.
And since we're speaking about values, I'd love to transition to Nicole on her thoughts on really how can we think about the local and policy mandates conversation and sort of building in some of the ways of thinking that you have talked about in your earlier remarks?
Yeah, well, I think there was some wonderful things mentioned, at the community level. I just want to cover one aspect because I think it's relevant in higher education institutes specifically, and that's how tenure tracks are set up for faculty, because there's very much a priority on individualized research impact. bringing up self, a lack of focus on transdisciplinary work as a part of that, and that de-incentivizes faculty within research positions at university to engage in systems thinking, in thinking through transdisciplinary, unless they're at higher levels in their professional careers where they have the ability to have those types of conversations, because it's very much pushed back against within the institutional policy levels of how these types of things work. So I would also love to see more conversations around how our educational institutes actually hold up progress within these areas because of the way that performance is measured, and impact benefit is to the person as opposed to the communities that the research is supposed to impact. And we really have a disconnect between what research benefit means. And it's very much based on ethical positioning within Indigenous communities specifically, which is completely disconnected from this, I'm the expert in this area sort of approach. And I've been brushing up against that quite often. And I know many Indigenous colleagues as well that come into spaces being very transdisciplinary because that's the nature of our communities, and having a hard time pushing these boundaries when it comes to what evaluation metrics look like in the context of success. So I just wanted to note that, because I think given the educational space that we're in, we're either incentivized or disincentivized to do certain things which progress research agendas, which allow space for these types of conversations. And if those are not set up to facilitate those, then we're just slowing down the train.
Mm-hmm. Yeah, but that's an incredibly important point, because just on that note, a few years ago when the work at UCSF began in this area, one of the things, and this was a long time ago, I want to say about 15 years ago, trying to speak with sort of the way it's trying to speak to the academic senate, to the institution about sort of how we can reflect a collective structure in contributing to the environment. Like, how are we all making sure that we are contributing to the larger dialogue, and that be really a part of the growth and promotion process for faculty at UCSF hit a wall, a very, very hard wall that received complete pushback and was actually quite demoralizing. And, fast forward, a decade later, and that dialogue is now on the table. But I think shifting the mindset from the individual to the collective still remains a huge challenge. So there's acknowledgement of the importance of that stewardship, that contribution to the environment, but it's very much at the individual level. I want to make sure, Dianne, you have a chance to really speak to the local and national policy mandates, because I do think a huge part of what you do with teachers and bringing them to the table and making sure they are geared to lead and teach, our youngest learners. How have you thought about that and navigated that?
Thank you. I think particularly for health professionals, there's a two-lane opportunity ahead in that regard. One is as a medical health professional, and the second is as a parent or community member. One of the things that we know is for our K-12 schools to be successful in this work is, first and foremost, they need to recognize and, most importantly, accept their role in this work. Without acceptance of it, with continued focus on other outcomes, we're missing a tremendous opportunity for our youngest citizens to develop the skills and knowledge and the awareness they need to be contributors to this conversation. So I think from our point of view, as a group of K-12 educators and the teachers that we work with, it's a high impact practice to have high quality health education instruction in every school. It is required by California law. It's the local policy that we need some additional support with. Every parent could have a conversation with their local school about health education. And if they wanted to speak specifically to a particular topic area, why not climate change? Very contemporary conversation, very important in families, particularly in California now. So our network sees that as, again, perhaps the most high impact opportunity to help schools accept that role in being able to provide high quality instruction and to inform their work.
Yeah, that's great. So as we sort of hit the end of our hour, I wanted to give I wanted to hear from each of you about how you recommend the University of California leads in this area. What do you recommend? What are the key future directions that you think a big system-wide initiative like this can move forward on the education? And I think Gaurab, love to start with your thoughts on that.
Sure. I mean, and Ariane knows I'm a Californian. I grew up in California, so I take a lot of pride in the UC system. So, what I would say is that I think universities have this unique opportunity. At our best, we're a place in which we are creating solutions. We're doing the deep thinking of how we can do things better. And so ultimately, we should be at the front lines of articulating these values of who we want to be, how we take care of patients, and how we do the deep work of creating a vision of our future, right? There's actually few entities in our society that have the mandate that institutions do in the academic space. And at its best, it's not just about, it's taking scholarship and putting it into action, and it's really making it real for our communities. It's bringing the expertise, it's bringing the support and funding and the creation of communities so that we can work through these big problems, and I think, again, we're really well positioned. There's a hunger for it. There's so much expertise. I'm so excited, the leadership of the center is a perfect example of the deep work and study and thinking that's happened over, a long period of time that we can bring forth to this. So I would just encourage, UC to really engage with its community, really engage with decision makers across, the governor's office should be going to the center and being, give me your best ideas. How do we do this better? And I think, again, we can be real partners. We don't have time just to sit around and talk about things. We got to put things into action, and we should be a part of that.
Yeah, that's great. Thank you. Cecilia.
Yeah, I resonate with everything Gaurab just said. And, of course, you're going to do the incredible research. Of course, you're going to do the incredible education. We know that's going to happen, just given the leadership of this team, it's going to be incredible. I see, with this massive and important and well-respected institution, you have the ability to convene groups that might not otherwise convene. For example, communities and businesses who are at odds with each other, or, the groups that don't necessarily sit down and talk. I think, the neutrality of an education institution has that power to bring people together around solutions. And so I would say, that would be one really cool thing to see the center do, because I think, you come from that space of deep caring of humanity, and with this neutrality that I think could break down some walls. So that would be very cool to see.
Yeah, thank you. Yeah, the interdisciplinary, the breaking down walls is definitely something that we are continuing to think about and grapple with. Nicole, I'd love to hear your perspective.
Thanks. Well, the University of California is a land grant institution, and there's responsibilities in my mind as a part of that for Indigenous peoples within the California area. In fact, California has the highest number of Indigenous people, not per capita, but per numbers, 14% of the total US population. And there has historically not been adequate engagement with tribal communities within that state as a part of any initiative, let alone this one. And my hope would be is to see more engagement with tribal communities within the area of California, not with an expectation of participation, because that would be not correct in terms of protocol, but a demonstration and trust building as a part of that process to hopefully see the elevation of Indigenous voices without any expectations or firm commitments from communities.
In terms of trust building, what are the one or two key things that you think are critical to that?
That's for the California communities to decide.
Thank you. Dianne, love to hear your perspective on this as well.
I think the University of California has a tremendous opportunity to provide access to the solutions to this conversation for all Californians. from its perspective of being on the front line of science, the front line of medicine, the front line of education, and the front line of equity. I think that access to all Californians to engage in, to learn more, to take action really is a more global way to talk about it. But I think it's something that the University of California is well equipped to be very effective at.
Great, thank you all. Well, thank you all for your wonderful insight and thoughtful collaboration today on this session. You know, we do have an imperative to educate and to train. It is really, I mean, you know, a colleague emailed me yesterday after one of our sessions and said, how are you sure the time is not already run out? I don't think time has run out. I think we have a chance to make a difference. And in our mental health panel today, we will talk a little bit more about this. But I do want to say that I do think our accountability here in the UC system is to prepare learners for a framework of environmental accountability that takes into consideration the collective, that our research, our education, our service activities are going to develop and promote and protect, you know, the solutions that we need to keep our planet safe. So thank you all very much. I'm going to turn to Sherry for the closing.
Thank you, Ariane. And wow, that was an incredibly interesting discussion. So thank you so much to our panelists, as well as to you, Ariane, for your great insights and for the really inspiring and impactful work you are all doing to really advance climate and health education worldwide and to all learners. And we're really looking forward to collaborating with you all as we move forward in this work. So just wanted to remind everyone that this discussion is the second of 4 panel discussions as part of our launch event for our Center for Climate, Health, and Equity. And I would like to invite everyone to join us for this afternoon session. So first, coming up at 12:30 p.m., we have a conversation on mental health and climate change, where you will hear from youth, Indigenous, and academic leaders about responses to the mental health impacts of climate change. Following that at 2 p.m. Pacific time, we're going to go to our final session called California's Climate Leadership, Bringing Health and Equity into Climate Policy. And this session is going to feature remarks from California State Assemblywoman Luz Rivas and from national, state, and local policymakers. And it is not too late to register for both sessions. Registration information is in the chat. So on behalf of the UC Center for Climate, Health, and Equity, thank you again so much to all of our viewers for joining, and thank you for our very esteemed and wonderful panelists. Please do stay in touch by visiting our website, signing up for our newsletter, and following us on social media. Thank you very much.